Welcome to the Central London Community Healthcare Antenatal Session. The aim of this session is to introduce the health visiting service and to give key information for parents in the antenatal and postnatal period.
Hello, I'm Jenny and I'm a health visitor.
Hi, I'm Angela and I'm a health visitor. Our health visiting teams work with mothers, fathers, their children and community groups to support health and wellbeing in children from the antenatal period until school age.
Our health visiting teams are made up of health visitors who are nurses and midwives who've done additional training, staff nurses, nursery nurses and our admin team.
Our support is tailored to your family's needs. Your health visiting team will work with you to determine what support you might benefit from throughout your journey.
We offer the following contacts to everyone: an antenatal contact, new birth visit when the baby is 10 to 14 days old, a 6 to 8 week health visitor review, 9 to 12 month developmental review, and 2 to 2.5 year developmental review. We also offer child health clinics in various locations across the week. These are a mix of drop-in and appointment only. As well as that, we have breastfeeding support services and workshops on introducing solid foods.
Pregnancy brings about big changes in your life. Everyone copes with these changes differently.
Some find it harder than others. It's worth considering what your support system is around you.
This might be your partner, families and friends, community groups,
volunteer organisations, both local and national, and of course healthcare professionals, midwives and health visitors. And if there's something you'd like to talk to us further about, then do get in contact. It's normal for parents to feel a wide range of different emotions in their transition into parenthood. And we know that in the first 10 days after baby's arrival, about half of mothers experience the baby blues. These can include feelings of being tearful, irritable, and overwhelmed. Perinatal mental illnesses affect up to 1 in 5 new mothers. While depression and anxiety disorders are the most common, other conditions include eating disorders, birth trauma, and post-traumatic stress disorders. Postnatal depression can affect anyone and can be treated with the right support and help. Dads can also experience depression in the postnatal period. Up to 1 in 10 fathers are affected. Symptoms include irritability, increased anxiety, anger, changes in appetite, and loss of interest in things and activities can also occur. If you feel symptoms, please contact your health visitor, midwife, or GP. They have experience in assessing and supporting parents with perinatal mental health problems. Help is available in a range of different forms, including self-help advice, talking support, psychological therapies, and medication. For severe mental health problems, you can be referred to a specialist perinatal mental health team.
If you're watching this, you might be having one of these. And if you're pregnant, chances are you've spent some time thinking about your baby. But how much time have you spent thinking about your baby's mum? That's you, by the way. How's she feeling? What's on her mind? Is she okay? Because every pregnancy, every baby, every mum is different. And sometimes when things are changing, it can be hard to remember to take care of yourself. That's why we've created a tool to help you. Whether you're looking for tips on how to improve your mood, extra support, or practical advice to prepare for after the birth. Thinking about your baby is a very normal part of pregnancy, but thinking about yourself should be too. Because you are your baby's mum, and there's no one more important to your baby than you.
It's really important during pregnancy and when breastfeeding for mums to take a vitamin D supplement of 10 micrograms a day. It might be that you're eligible for Healthy Start vouchers and we can signpost you towards those. The Healthy Start vouchers give you a voucher to go towards your fruit and veg shopping and also to collect free vitamins for mum for the first year after pregnancy and for children up to the age of 4.
Hello, my name is Brittany and I'm a health visitor, and I'm going to be talking to you about babies' brain development. Babies are born with billions of brain cells which start to develop and connect to one another soon after conception. During your pregnancy, your baby's brain cells will already be sending messages to do with touch, hearing, movement, and the senses of taste and smell are beginning to develop. These continue to develop at a fast pace once your baby has been born, and it is these positive early relationships and experiences which will help strengthen these connections. Your baby's brain will develop best when they are relaxed and enjoying what is happening in their life. Your baby will need love and attention from the day they are born, as this will help them to feel secure. When babies feel secure, they release a hormone called oxytocin, which supports their brain development. There are ways in which you can create a loving environment for your baby, which may include talking, reading and singing to your baby from pregnancy, responding to your baby's needs, providing a safe and loving home, and helping your baby explore new environments. Factors that would have a negative impact upon your baby's brain development are conflict in the home, misuse of substances such as alcohol or drugs, abuse, or being exposed to violence. If you have concerns that your home environment is not safe or secure, it is important you speak with your midwife or health visitor as soon as possible.
This is the Personal Child Health Record, also known as the Red Book. It's a national standard health and development record given to parents or carer at a baby's birth. Parents and health professionals use the Red Book in the management of your child's health care. We also have the online version that we call the e-Red Book, which you can download on your smartphone for your personal use. The Red Book contains your child's immunization schedule. Vaccinations start from when your baby is 8 weeks old. If you have any questions, please speak to your health visitor or GP.
Hi, I'm Jane Markwick and I'm an infant feeding and healthy weight team lead. When a baby is born, they're born into a world that's very strange to them and unfamiliar. There's lots of space, it's very cold, and they can't hear that heartbeat and the mum's voice that they've been listening to for the last 9 months. So what we recommend when a baby is born is to put the baby skin to skin at delivery. And by doing that, what the baby's going to do is the baby will start to hear mum's heartbeat. And by listening to that familiar sound again, they're going to start relaxing and calming. And that's going to regulate baby's heartbeat, temperature, and breathing. It's also going to create a surge of oxytocin within baby and also within mum, which is going to help mum start produce breast milk. And what you'll see in that time when baby's skin to skin is you'll see that baby starts to go through 9 stages. And some of those stages are crawling across the tummy. They'll also search and they'll start to rest as well in between. But the ultimate goal is that baby is trying to find food and latch on themselves to the mum's breast for the first feed. So we recommend that the baby stays in skin to skin until the first feed. Both breast milk and formula milk provide the baby with nutrition and hydration. However, in breast milk you get added benefits as well through the things that mum's passing on from her breast milk to baby, including stem cells and immunities. So you're starting to build the baby's immune system right from the start. You're also reducing the risk of ear infections and chest infections, and later on reducing the risk of things like obesity and diabetes for babies through breast milk. Mothers also reduce their risk of breast cancer and ovarian cancer by breastfeeding the baby, and it can also help reduce the risk of postnatal depression.
Hi, I'm Iman Haikor. I'm the infant feeding and weight management lead and a lactation consultant with the health visiting service. One of the most frequent questions we get asked is how often and when should I feed my baby? Babies let you know when they're hungry by showing hunger cues. The earlier that you can pick up and respond to these cues, the easier it will be to feed your baby. Early cues include stirring, mouth opening, and rooting, which is seeking food. Mid cues include stretching, increased movements, and bringing hand or blanket to baby's mouth. Late cues, which include crying or baby becoming agitated, often mean that you've missed the earlier cues, so baby needs to be calmed before you can feed. Remember, you can use skin to skin at any time to help calm a baby. Babies have small stomachs, so this means that they need to feed frequently. If you've chosen to breastfeed, the first milk that mum has is called colostrum, and this is a small volume of milk packed with all of the benefits discussed earlier. A few days later, this milk starts to change as your milk comes in and has all of those fantastic benefits just in a larger volume. Many people think of breastfeeding as a natural process, but it's a new skill for mums and it's a new skill for babies to learn, and it can take some time to get the hang of it. Partners can play a vital role in supporting the breastfeeding journey. For more information on how your partner can help you with this process, please see the website listed. Your health visitor and your midwife can also provide you with support. We know that a lot of women stop breastfeeding before they want to because of perceived lack of support available to them. However, we want to let you know that we have support available for you in your local community, and this can be through breastfeeding support groups, appointments, or through breastfeeding helplines. So please don't hesitate to ask for help.
Positive communication and skin-to-skin between babies and parents or carers promotes unique relationship between both when they are emotionally well. Children-adult relationship that are responsive and attentive with lots of back and forth interactions build a strong relationship in child's brain. This leads to the promotion of learning and development later in life. This is called serve and return, and it takes two to play. These are the 5 steps. 1. Notice the serve and share the child's focus of attention. 2. Return the serve by supporting and encouraging. 3. Give it a name. 4. Take turns and wait. Keep the interaction going back and forth. And 5th, practice endings and beginnings.
During your pregnancy, it's a good idea to start thinking about safe sleeping. Look at the 2 images. What differences do you see? Image number 1 shows what we do not recommend. Image number 1 shows baby is in their own room. Baby's cot is placed next to a radiator. Baby is wearing a hat. There are too many blankets in the cot. Baby is positioned to sleep on his side and is also too near the top of the cot. There are also cot bumpers surrounding baby. Image number 2 is what we recommend. Image number 2 shows that baby is in parent's room. Baby's cot is not near the radiator. Baby is not wearing a hat indoors. Baby's cot is free of any extra blankets or bumpers. Baby is sleeping on his back and is positioned at the foot of the cot.
Hi, my name's Caroline and I'm a health visitor. I would like to talk to you about a crying baby. All babies cry, but some babies cry more than others. This is your baby's way of telling you that they need comfort and care. The most common reasons are hunger, dirty or wet nappy, wanting a cuddle, wind, boredom, being too hot or cold, or overstimulation. Here are some strategies that work to help you cope with a crying baby. Cuddle your baby, skin to skin, talk gently, Take them out in a pram or for a walk, as motion reminds them of being rocked. All babies go through crying episodes for no apparent reason, and this has no bearing on your parenting.
And finally, don't neglect yourself. Take as much rest as you need. Ask for and accept help. Sleep or nap during the day. Eat a healthy and balanced diet.
Set realistic goals, but don't overdo it. Go out for a walk every day. And if you have any worries, speak to your family, friends, and your health visitor.
We thank you so much for joining us today, and we hope you find this information useful. We look forward to seeing you soon.